We're talking about it again, a horrifying act of gun violence at an elementary school in Uvalde, Texas, where 21 people, 19 of them between the ages of 9 and 10, were brutally murdered, most of them inside a single classroom. We're talking about it again, worse for some because it once again involves children, but also compounded by the fact that we've been once again talking about racially motivated gun violence after a white man shot and killed 10 black people at a supermarket in Buffalo, New York. And these are just two of the many, many mass shootings this year, even this month, the ones with high enough death tolls to make the nation pay attention, at least for a little while. According to the FBI data released Monday, there were 61 active shooter attacks last year alone, killing 103 people. That was the highest annual total since 2017, and a pattern some lawmakers are calling for action to end.
Is that as this slaughter increases, as our kids run for their lives, we do nothing. What are we doing?
These kinds of mass shootings rarely happen anywhere else in the world. Why are we willing to live with this carnage?
Questions I hope the people who continuously vote against common sense gun reforms will answer, but I'm not going to hold my breath on this one, and neither are my next guests, who argue gun violence needs to be viewed as a public health crisis in this country. Dr. Chana Sacks is physician and co-director of the Mass General Hospital's Center for Gun Violence Prevention, and Dr. Lois Lee is a pediatric emergency medicine physician at Boston Children's Hospital and an associate professor of pediatrics and emergency medicine at Harvard Medical School. Welcome to both of you. Dr. Sacks, I want to first start with you and acknowledge that there are now members of this large community of people who have lost loved ones in shootings, both individual shootings in crime that happens, as well as these shootings in supermarkets and churches and schools. And you're part of that family, as your cousin's son, Daniel, was a victim of Sandy Hook. I know someone, a colleague, who had a best friend who was killed in a school shooting. This community continues to grow, sadly. It's some of the damage that we all suffer from, even though we're not directly part of that. That's part of this problem when it comes to the damage of these shootings. And I thank you for joining me on this day, right?
Sue, thanks for having us. It's a horribly painful day, and just to see those images, it's wrenching. And like you said, for me, but for so many of us, it's personal, and it's deeply personal. And we're here because I believe that we can do better. I believe this is not inevitable, that we don't have to live like this. I hope over the course of this conversation, I'm going to convince you of that.
Dr. Lee, we live in a society, I mean, missteps, around COVID and masks and all sorts of things. There's always going to be this sort of, science and progress and invention and then backsliding. But we have been doing a pretty good job over the past century of keeping people safer, right? And keeping people living longer and making inventions that help us, except when it comes especially to gun violence. What can we do, what can you do to help convince lawmakers and people that gun violence is a public health problem that is at best solvable? At worst, we could reduce the deaths and injuries remarkably with some effort.
Right. Well, I think, as Dr. Sacks says, we cannot accept that these are inevitable, and much less that we cannot accept that these deaths are acceptable, right? We can't just say, oh, well, there was just another mass shooting, because there are known strategies to certainly decrease or mitigate all these gun deaths. And there's many more injuries, right, for the deaths that we hear about. And unfortunately, it's a very politically divisive issue that requires political will to make a change. We need legislation, basically, to keep guns out of the hands of people who are at risk, not just for harming other people, but harming themselves. Also to make sure that guns are secured appropriately. But again, because it's such a politically divisive issue, it's really hard to get the political will and to get, as you said, the common sense for people to want to make a change.
Dr. Sacks, the difference I feel right now talking about this then, especially because it's children, as I noted, there's been other shootings and there's always shootings. But having come from the pandemic we're still in, where, you know, I think all of us were desperate to get our kids back to school, most of us, the majority of folks, where we hoped that they would be safe. And the reluctance of some people to vaccinate, the reluctance of some people to wear masks in the face of science. And now here we are with another school shooting. And it makes me a little bit more depressed that I'm not sure we have the will to follow the science, as we've been saying, that there are ways to reduce the gun deaths in this country, especially of children. Give me a pep talk and tell me what I should be doing to make that change.
I mean, there's no question, right? Shutting down schools cannot be the only pathway to ending school shootings. This is horrendous, and we can't live with it. But there are reasons to believe that we can really make a difference here. That I think the political will obviously is challenging, but it's changing. And there are local things that we can do in all of our communities to take action and make a difference here. And we really, really need to recognize that. Those people out there who are saying that there's nothing more that we can do, who are throwing out really delusional assertions that the solution here is more guns in schools, that's the only thing we can call it. And usually I'm pretty measured, but I mean it when I say it. There's no other word that I can come up with it. That the idea, the notion that we can add more guns to this problem and shoot our way out of this problem is just not true. So often we've been offering complex, multifaceted solutions that Dr. Lee mentioned are going to be needed. Some are legislative. Yes, we need background checks. Yes, it'd be a really good idea to have an ATF director whose hearing was today. Yes, red flag laws around the country federally make sense. There's a lot of legislative pathways that we need to go down. And then there's also teenagers shouldn't be able to walk in and buy AR-15s and body armor. Those things are absolutely true, and we need to acknowledge those and really move towards that path.
Dr. Lee, obviously it's not a constitutional right to drive a car, right? And this is something that I think many people, I point to this analogy all the time. I am sometimes, you know, I live on a residential street in Roxbury, and it's got a curve to it, and there's a daycare near it. On a regular basis, you know, the kids are all walking along holding on to their little rope, and a car is speeding, and I think, my gosh, if we invented cars this week, we would never let kids get that close to cars on the street and the sidewalk. We just recently put in speed bumps on my street, so that has decreased my anxiety somewhat about these little peanuts getting hit by a car speeding. We have these dangerous things that we do every day in the car, but we continue to reduce car deaths, vehicle crashes, except during COVID, I know those numbers went up. Find ways to make cars safer, and it doesn't really take our joy of driving away. Why can't we get there with guns and gun violence and the use of guns and the ability to have a license to get or use a gun?
So we recently published that because of all the public health, steps that have occurred, motor vehicle crash deaths that used to be the leading cause of deaths for children and youth 1 to 24 years have now become the second leading cause, and firearms, right, are the leading cause of death for children and youth. But basically, there's an infrastructure that allows us to license and regulate, right, people who have a car, right? You can't buy a car unless you take a driver's test, you get a license, and you have to have insurance, and you're registered. So we know who owns a car. We don't know that about guns. We barely know. We don't even really know how many guns there are in the United States. All we can say is we know that there are more guns, somewhere around upwards of 390 million, right, compared to the 370 million individuals in the United States. So we need an infrastructure for motor vehicles. We have the National Highway Transportation Safety Administration that is really tasked with not only making cars safer, but roads safer. And then, insurance companies are making sure that cars are also built safer. So now actually automotive manufacturers, right, they're incentivized to build safer cars. Well, we can incentivize gun manufacturers there's technology for personalized smart guns. So basically that only the authorized user can fire a gun. That technology exists. but it's not sold to the United States. So there's technological solutions, but we do need probably an overarching sort of system like we have for motor vehicles to track the data and really monitor continuous improvement so that we can decrease firearm injuries and deaths.
I mean, obviously, Dr. Sacks, we talk about these situations when we have these unfortunate and preventable mass shootings, but the other reality is suicide numbers have been and self-harm numbers are going up with teens, while we're seeing statistics that teens are now more likely to have guns in their home or themselves than they've had in the past. And we know from data that if there's a gun available, you are more likely to sadly be successful in a suicide attempt than if you don't have a gun in the home. And we are seeing, interactions between teens, violent interactions in some spots, many of it because of mental health crisis and COVID crisis is in a number, but if they don't have guns, those interactions are less likely to be as violent, the outcome, and as they would be with guns. So when we're talking about this big event, this sad, tragic, horrific event, we also have to keep in mind that every day there are opportunities for us to reduce gun violence, deaths, and harm to children via guns, right?
Sue, every single day. And it's one of the most critical things to emphasize. We're here in Boston, theoretically one of the safest cities and one of the safest states when it comes to gun violence, and still gunshots are going off almost every day in our city. The ripple effects of a gun, we only tally deaths really reliably on a national level. We only tally deaths. We're not counting the number of people who survive these non-fatal injuries and become our lifelong patients. We're not tallying the people who bear witness to this violence and are struggling with the ramifications, both physical and mental health ramifications of these injuries. And one thing that's really critical, and that I'm going to ask them, that you, Sue, that all the media really thinks about differently, is that we have to pay attention, not just during these times of these horrific shootings that really stop us in our tracks, but every single day. We have to do better of transforming these narratives of gun violence. So everybody, every reporter, every person in the media who's writing a story today about Uvalde, about Buffalo, in Dorchester, we cannot just focus on these communities on their worst day. We have to uplift the amazing work that's being done in these communities that has been being done for decades. There are so many people in our city of Boston who have been on the front lines of these issues for decades. The Peace Institute in Dorchester, Reverend Clementina Cherry, one of my personal heroes, who has been doing this work of healing and community building every single day. And we have to do a better job of centering the voices of those survivors and uplift their work, because that's what's going to be our pathway out of this. This rapid fire news cycle, we all know it's broken. We all know there's a problem, and yet we have trouble getting past it. But that's part of our pathway through it, is centering the voices of survivors, not just today, but over the weeks and months to come, and see what's happening in those communities, seeing what works from the people who've been leading this for decades.
Dr. Lee, one of the things I think we in the media could do a better job of is discussing things, the victims and the crimes and just the horror of it more accurately. Julia Kayyem, who's a frequent guest here at Greater Boston and Boston Public Radio, talked about how we should be using the word massacre, because that's what it is. We should be talking about the horror these parents are going to have to go through, because the way these bullets work will make some of these children, these victims, their little bodies unrecognizable without DNA or without clothing to recognize them, much as it was, unfortunately and sadly, at Sandy Hook. And that we need to tell kids that getting shot hurts, that it can have a lifelong, as you mentioned, Dr. Sacks, a lifelong chronic illnesses or pain. Should we be doing that? Am I right, Dr. Lee, in thinking that we need to be more graphic in our discussion of this?
I don't think it's graphic, it's accurate. How else are you going to describe the the unbelievably horrible death of 22 elementary school age children, right, killed by a gunman at their school? That is a massacre. And if I can't think of any better definition of that. So I think these are accurate descriptions, and that guns are made for really only one purpose, right, to maim or kill. And so by definition, they are going to cause an immense amount of bodily damage, if not death. So I think making sure that that story is loud and clear, that guns are not toys, right? And that's the unfortunate thing, is sometimes children will find them unintentionally and then shoot their brother, their sister, their friend. And that's a whole different level of sort of mental trauma for that child and that family.
Yeah, Dr.
So I think just telling the truth is enough.
Dr. Sacks, to your point, toddlers shoot guns all the time. Not all the time. I don't want to overstate it, but death by a toddler finding a gun is not uncommon. Parents have been shot by toddlers.
We've all seen those news stories, and the data bear it out, right? These mass shootings that we're talking about, like the one that devastated my family, the one that people are reeling from today, account for far less than 1% of all gun deaths in this country. 1%. We still need to talk about them, but we need to recognize that. Those unintentional shootings you're talking about, it's about 2%. Other homicide and interpersonal violence, about 1/3. And suicide, which you mentioned, almost 2/3, 60% of all gun-related deaths. And we need to be talking about it in that way. Easy access to guns is absolutely the common link, but each of those different types of gun violence is going to have different root causes and opportunities for intervention. And that's why anybody who's looking for one single solution or one single law or one single announcement by some politician isn't going to find it. This is a multifaceted problem that's going to require all of us and different approaches, but each of them is possible to solve.
Dr. Sacks, Dr. Lee, I appreciate you taking time and I appreciate your work. Thanks for joining us.
Thank you.